So this patient is come to me. I will ask, first of all, I will ask that how many days you are coughing. I will check her chest shape. If the chest shape is barrel shape, then I will think that it may be a patient of emphysema. For the proper diagnosis of emphysema, then I will auscultate. For the auscultation, I will listen her lung sounds with the help of stethoscope. Okay, if the lung sounds is like this one, wait. Like this one, it's mean air is moving inside the alveoli easily, but exhalation of the air is difficult for this patient. So I will diagnose this patient is of emphysema. Further, if I will further I want to diagnose the patient that it is obviously the patient of emphysema, then I will do a clinical test like PFT test, pulmonary function test, with the help of spirometer. And with the help of spirometer, I can check that how much volume he can inhale, and in the 1 second how much volume he can exhale. Mean the ratio between the FE1 mean forced expiratory volume in 1 second and forced vital capacity of the air in one breath. If it is less than zero point 0.4, then I will think that this patient of emphysema. Now I will check this patient with the help of stethoscope. Breathe inside. So this is the normal lung sound. And if this patient is of upper respiratory tract infection, then the lung sound will be like this one. This is the stridor. Stridor is which sound? This is the upper respiratory infection. This is stridor. This is stridor. Okay, it means this patient have upper respiratory infection. Okay. After that, I will listen her sound. And if the sound is like this one, this is a patient of emphysema because expiration is difficult for this patient. Okay. And if the sound is like this one, if the sound is like this one, like coarse crackles, okay, then this is the patient of pneumonia. Okay. And if the sound is like if the sound is like fine crackles like this one, like this one, then the patient is of fibrosis, pulmonary fibrosis. Hopefully you understand that how we will diagnose the patient on the basis of auscultation.